It's a great honor to introduce our article through this video clip. I'm Song, the first author of this article from Busan National University Hospital, Busan, Korea. Our article is about clinical efficacy of ultrafast DCE-MRI using compressed sensing in the evaluation of soft tissue tumors. Soft tissue tumors represent a heterogeneous group of benign and malignant tumors with overlapping radiologic finding. DCE-MRI is an imaging tool for evaluating the microvascular environment of a tumor. In conventional DCE-MRI, long scanning time is required for an acceptable spatial resolution, so faster sequences are required for obtaining clinically useful DCE-MRI. Adding the compressed sensing technique is expected to reduce the time required and analyze the early arterial phase. Using CS, it is possible to reconstruct and MR images from less data than with traditional acceleration methods. Unlike conventional DCE-MRI, the parameters of the early arterial phase can be obtained, allowing additional information when evaluating STTs. So the purpose of our study was to investigate the clinical efficacy of ultrafast DCE-MRI using CS technique and obtain parameters of the early arterial phase, conventional DCE parameters, in the evaluation of STTs for differentiating between benign and malignant tumors. For about 5 years, 634 patients having STTs were examined using DCE-MRI using the CS technique. Most of the patients were excluded because of the various reasons. 165 patients with an initial single STT were included in the study. Pathology results, including final diagnosis, and FNC LCC grading for malignant STTs were reviewed for all patients. We used 3T scanner for the MR exam, and all MRI protocols include conventional MR series, diffusion-weighted images, and ADC map, and DCE-MR scans. Ultrafast DCE-MRI was performed based on the 3D vibe sequences with CS reconstruction. Delayed contrast-enhanced images were scanned in all 3 directions using a fast-suppressed spin echo T1 weighted imaging. This table shows the acquisition parameters of CS vibe sequence. As you can see, total acquisition time is about 4 to 5 minutes, and it is about 2 times faster than previous DCE-MRI. In post-processing, quantitative parameters of the early arterial phase were obtained using non-commercial prototype software, and conventional DCE parameters were determined using the tissue 4D software during the delayed arterial phase. Images were reviewed by 2 musculoskeletal radiologists. They evaluated tumor size, location, depth, presence of peritumoral edema, and tumor heterogeneity on conventional MR images. On diffusion-weighted images, visual diffusion restriction, mean and minimum ADC value were evaluated. DCE-MR parameters were as follows. In early arterial phase, TTE, TTP, IAUC60, and MS value were obtained. In delayed arterial phase, K-trans, KEP, VE, IAUC value were obtained too. And the reader determined the type of time concentration curves. Logistic regression analysis was used to identify factors useful for differentiating between benign and malignant tumors. The Spearsma rank correlation analysis and Fisher's exact test were used to investigate the factors correlated with the FNC LCC grade in malignant STTs. Inter-reader agreement for diffusion-weighted image values was assessed by using ICC. ROC analysis was applied to determine the appropriate cutoff values of factors. Let me show you our result. This table shows the types of soft tissue tumors according to the WHO Pathology Classification 2020 version. There were 111 malignant soft tissue tumors and 54 benign soft tissue tumors. Patients with malignant soft tissue tumors were significantly older and showed larger mass size than benign tumors. If the tumor was peripherally located, the probability of being benign was high. In the contrasting images, the more severe the heterogeneity, the higher the possibility of a malignant tumor. Peritumor edema also showed a significantly higher frequency of malignant tumors. TT value among the early arterial phase factors and VE and IAUC values among the delayed arterial phase parameters were significant in differentiating benign and malignant tumors. Factors that have a significant correlation with FNC-LCC grade in malignant tumors were as follows. As the FNC-LCC grade increased, the frequency of peritumor edema, deblocation, and diffusion restriction increased, and the minimum and mean ADC and TTP values are decreased significantly. Higher the FNC-LCC grade, the higher the KEP and VE values, and the higher the frequency of type 3 and 4 on the TCC graph. This table shows the ROC curve analysis of age, mass size, and parameters of diffusion-weighted image and DCE-MRI. The AUC was highest on TTE, when the TT value was less than 6.47, the possibility of malignant tumor increased. Let me show you our cases. This is case about a 74-year-old woman with undifferentiated pleomorphic sarcoma, FNC-LCC grade 3 at right buttock. About 15 cm sized, well-defined mass with heterogeneous high signal intensity is presented at right gluteus maximus muscle. The mass shows strong enhancement on contrast-enhanced image. On axial diffusion weighted images and ADC map, there were some portion of the diffusion restriction. In the early arterial phase of DCE-MRI, TT value was 1 second, and the slope of the graph shows a steep slope. The delayed arterial phase using tissue 40 shows a high K-trans value, and the graph shows type 3 pattern. In both the early and delayed arterial phase, the mass was determined to have a high probability of malignancy. There were some limitations in our study. The number of malignant tumors included in the study was approximately twice that of benign tumors. And also, selection bias occurred because patients with superficial cancers such as malignant melanoma or squamous cell cancer and intermediate STTs were excluded from this study. In conclusion, kinetic characterization of STTs through early and delayed arterial analysis might be achieved within a considerably shorter time using ultrafast DCE-MRI. TT value, in addition to clinical factors, conventional MRI findings, and parameters of conventional DCE-MRI, will enable high accuracy differentiation of benign and malignant tumors. Thank you for your attention. If you have any questions or comments, please feel free to contact us.